we're going to be the 15th parish, might as well we just build a state-of-the-art health centre. When you look at the state of Waterford Health Centre, even a room for the staff members, the doctors and nurses, is just not there. Limited amount of space and the convenience is just not there. So I had lobbied to the Minister of Health and himself and the Chief Medical Officer and the manager for St. Catherine came and did a tour of the facility. While we toured the facility, we realized that there is a need to relocate the health center because where the health center is located currently doesn't have the space to really expand, and the structure is not solid enough to really expand on the facilities that are there. What we did, we found a parcel of land that is situated in the constituency in close proximity of where the current health center is. I searched with NLA, Land Agency, and I realized that the land is owned by the government. So I spoke to the manager for St. Catherine Health Department and the CMO, and they already had a plan in place. So I told them that I would love more amenities, on the facility. If we're going to be the 15th parish, might as well we just build a state-of-the-art health center. So all the documentations is currently at the Ministry of Health. I know National Health Fund, view the facility as well. Week before last, they came and they analyzed the area where it's destined for the new health center. And that in itself was viewed and toured by them. Last week I received a call from the CMO of Dr. Prosper Chen stating that she wants to come and look at the new location. So I assume, and I'm in the minister's ears every week, I see him at Parliament, that we need a new facility in Waterford. So, keeping our fingers crossed, I'm not stopping until we get a new location. And hopefully pretty soon we should have a new health center for Waterford citizens and its environs.
You mentioned an upgraded health center. What are you looking at? A type 5 health center?
We want the biggest type. Here in Portmore, we know that the health center, accommodates a lot of citizens, not only in Waterford, but the environs, The dental clinic also in Bridgeport needs attention. So it's just fitting that, a dental clinic is situated on that new facility as well. It's a large parcel of land. I couldn't tell you the square feet, however, I don't know if it's half acre or acre, but it's a large parcel of land. So it's best that we put the amenities that are needed, the need of Portmore. A lot of citizens of Portmore suffer from renal failure. A lot of citizens from Portmore suffer from mental health. A lot of citizens from Portmore suffer from dental, works and etc. So we just want to ensure that we have a state-of-the-art, health center.
From the perspective of the hospital that the Prime Minister had announced on one of his visits to Portmore, how far advanced is that project?
I would not be the best person to answer that question, but as far as I know there is a new hospital that is destined to be built in St. Catherine. It's under the IDB project, I think. Same project with the Greater Portmore Health Centre, same project with the Spanish Town Hospital. But the Prime Minister gave his assurance that the hospital that is destined for St. Catherine will be in Portmore. I have no doubt that the Prime Minister will, come true to his words. He's always a man of his word. Also he's regarded as a builder, in terms of institutions. So I have no issue or no doubt in my mind that there will be a hospital in Portmore.
You don't foresee that coming before the parish is officially proclaimed, but the municipality is officially proclaimed the parish?
Well, I've heard the argument out there that why should we become a parish and we don't have a hospital? You know, when the technocrats in the ministry came to the Joint Select Committee and stated that there is no need for an hospital to give them parish status, right? Without that though, there's a need, in my view, for a hospital to be here. But according to the technocrats, that's not a requirement for parish status to be given. They went on and they said, as I stated in my report in Parliament last Tuesday, that the worldwide benchmark is for the furthest point in Pomor, that they should be 10 miles radius away from a health facility. And in our calculation then, the furthest point in Pomor is less than 10 miles to Spanish Town Hospital, and it's less than 10 miles to KPH. But saying that to say, I'm a strong believer and I'll be an activist for a hospital to be in the parish of Pomor.